Welcome everyone to concurrent session B3, CRCL, Improving Outcomes for People in Crisis, Responders and Community. My name is Julie and I'm joined by my colleague Caitlin, and we will be your facilitators for this session. Before we get started, I will review some quick housekeeping notes and then I will introduce our speakers and begin the session. So you've probably already heard this speech since this morning, but we will have to do it again. Make sure to use the Q&A feature at the bottom of your screen at the toolbar to submit any question throughout the presentation, and we'll have about 15 minutes at the end of the presentation to go over your questions. Please ensure your microphone is on mute until the Q&A portion of the session. You can also raise your hand to ask a question. I feel like we're going to be a fairly small group, so if you would like to speak up, I'm sure we would be open to it. I would like to remind everyone that we have closed captioning for all our sessions, so you can click on the CC icon below the video window to access this function. We also kindly ask that you complete the evaluation for this session by clicking on the session in the agenda on the virtual platform. There will be a survey button at the bottom of the session next to the join button. We really appreciate your feedback. I will also remind you again before you guys leave at the end of the session. And we would like to respectfully ask all of those attending today's session to engage with each other thoughtfully and always consider the impact of your words and interactions on others. And we won't tolerate any abusive or inappropriate behavior. So as facilitators, we will have to remove you from the session if you do engage in such behavior. If you're in crisis or require immediate support, please click on the FAQ icon on the conference homepage to access contact information for Connex Ontario. And if you liked any sort of incident or report any incident, please contact the event manager, or you can click on the assistance button. And if you have any tech issues, you can also message Caitlin or I during the session. So that was kind of it for my spiel. I would like now to introduce to our presenters for this session. We have all three presenters are from the Canadian Mental Health Association BC division. We have Kim Mackenzie, who is Director of Policy, Johnny Morris, the CEO, and Nick Sandor, CRCL Clinical Director.
Well, thanks so much, Julie and Caitlin, and the tech team for being such good hosts and welcoming us into this space. I really appreciate it. And I'm really honored to support the launch of this presentation alongside my dear colleagues Kim and Nick today, and in absentia Sarah Potts, who's been so skilled in bringing our materials together and preparing some excellent material. So I'm Johnny Morris. I use he/him pronouns. I have the honor of serving as the CEO for the provincial division here in British Columbia. And we're here today to talk about some really innovative and transformational work that we're leading in close collaboration with other leaders in BC in and around improving outcomes for people in crisis and their responders and their communities. And we're really grateful to be able to share a picture of lives changed and lives being saved in response to some really important crisis care transformation work, which in many ways has been inspired by work that's been led in Ontario and other places across the world. So Kim, I'll get you to go to slide 2 here, and really important for us to acknowledge and celebrate and honor the lands on which we do this work across BC. The CMHA, and we recognize CMHA is a settler organization that has been in and around in existence for over 100 years, and in many ways entwined with practices of colonization and other histories. And as part of our work at the BC division, we honor gratefully the lands in which we work on and stand on. And for me today, those are unceded ancestral Musqueam, Squamish, and Tsleil-Waututh territories. And our team, you'll hear from them in a moment, are joining from unceded ancestral Lekwungen-speaking territories, particularly Songhees and Esquimalt lands. And those are the lands on which our offices operate and work. We're very grateful for that. And very, very grateful for the ways in which we've brought about meaningful partnerships with First Nations communities as part of crisis care reform in partnership and led by First Nations communities going forward. So, who's here in front of you today? You've heard a little bit about me, but I'll hand things over to Kim and Nick to introduce themselves, and then I'll firm up the agenda and what's in store before handing things firmly over to the team to walk you through. But what I will say is, for me, I've been with CMHA for almost 2 decades. I grew up at CMHA. It's a big part of who I am in the sense of my strong and unwavering belief in community delivered mental health care and mental health services. And I come at this work with my own lived experience personally of mental illness. I live with depression, my own lived experience of responding to people in crisis and distress, both personally and professionally, and with a deep, deep care for ensuring that mental health is a right for all. So I'm very, very grateful to be here alongside Kim, who I'll hand it to next.
Thanks, Johnny. Hi, everybody. It's really nice to see you on the screen here and host this wonderful conversation. Really excited to bring some perspectives from BC. I know there's lots of folks in the room from Ontario. So, as Johnny mentioned, my name's Kim Mackenzie. I'm the Director of Policy here at CMHA BC. My pronouns are she, her, and I'm really passionate about systems transformation, in particular, looking at ways that we can better support people experiencing crisis. And I've been in this role at CMHA BC now for over 3 years, but really been working in community as a community advocate, really looking to find alternative ways to support people experiencing crisis, moving away from sort of justice-oriented, policing-based approaches to community-led approaches. So it's kind of a pride and joy to be able to do this work and kind of realize some of that advocacy in fundamental systems change. So my role is really kind of big picture systems integration, government relations, advocacy related to this work. And I'll pass it over to Nick to introduce himself on my team as well.
Thanks so much, Kim, and thank you all for being here today. I think we're all really excited to talk about this service and what it's meant in our community, and I think just all the successes and challenges and interesting pathways that emerged along the way. So my name is Nick Sandor. I'm the Clinical Director for Crisis Care at CMHA BC. I've been working in community services and specifically and mostly with community-based mental health for about 15 years now, a lot of that building community programs, and I'm really excited to share this particular program out today. So my formal background and training is in social work, but I do really enjoy building programs, getting people the things they need, and working along both of these fine folks to make that happen and make sure that all the communities across our province have the services that they deserve. So thank you.
Great. Well, what are we going to do with you today? Well, the first thing I'll say is, speaking for myself, and I think my team share this, we're huge fans of what HSJCC does and how you've convened and brought together different sectors, particularly around the mental health and social justice and also justice, public safety side. And so we're really, really grateful for the opportunity to share and situate what we've learned in this work that's happening in British Columbia across these points that you see on this slide. So over the course of the time we have with you this afternoon, your time, is we're going to bring forward, and Kim and Nick will lead this in such a good way. We'll discuss what CIRCLE is as a model, crisis response community-led, as a model of provincial and scalable crisis response. And that's something we've seen in lots and lots of ways, the scalability. We're going to share quite a bit of detail about its origin story as a single pilot site through to a multi-year provincially supported commitment to fund 10 CIRCLE teams. We're not quite there at the 10, but we're well on the way with significant investment from the government of British Columbia. And we're very, very grateful for that level of deep support from the province in making CIRCLE a reality over the past 3 years. We really hope to as well share how CIRCLE really is community-led at its roots, how it's led by community alongside community, and how this provincially supported model of crisis care in BC has truly, and this is proof in the pudding, delivered timely in-person supports for individuals experiencing a range of mental health crises as part of their journey. This session is really designed to help you learn more about the growth, the elements of which Nick and Kim and the broader team have built into its scalability, and the vital role of lived experience. The co-production alongside lived experience has been such a feature of our work, and it truly has transformed how we do our work, but also the experience we think of crisis care delivered by community in community. And all of this, if any of you follow the headlines in the news, you know that this crisis care work is happening against a complex, dynamic, ever-shifting landscape of political and public discourse about mental illness, about mental health, about substance use, and about public safety, and what's called social disorder in the streets. But really, truly, what that is folks experiencing historical exclusion, stigmatization, and vulnerability by virtue of the systems that they are impacted by. We will also endeavor to show you the ways in which we've co-produced models for better collaboration and community response. We'll showcase for you the centrality and the foundational role of lived experience, as I've mentioned before. There's been such innovation across the operators of these teams around how to ensure that crisis care is a team effort, that people aren't on their own grappling with these real challenges. And so there's some beautiful models that have informed team resiliency across these teams, which we're keen to showcase for you too. And there's a lot to be said here in BC as to how, as I mentioned a moment ago, the distinct political and social context has both enabled, propelled this work around Circle over the past number of years, and also been challenging to respond to as well. So we have lots of insights that we think are relevant to justice, health, and social service sectors, which of course is at the heart of how HSJCC convenes there in Ontario and beyond. We anticipate that you'll take away some key things from today's session, what Circle is, how it was developed, how it operates, so some brass tacks around the operational logistics and the clinical attributes of this service. The team, we hope to be able to help support your learning in how the role of Circle is situated in a crisis care continuum. Our advocacy to build out more pillars of crisis care in British Columbia, we're probably the closest we've been in some communities to realizing a fulsome crisis care continuum, and the team will explain what I mean by that later on in this session. We'll share what a difference it can make when a provincial government is behind transformation in community whilst respecting and protecting that local community leadership. And we'll also give you a sense of some of the enablers that keep us going and we hope towards future scalability as well. There'll be lots of time for questions at the end, I hope. I'll just round out my comments very, very quickly here to say many of you are familiar with CMHA nationally as one of Canada's or the most established mental health charity in Canada. We in British Columbia have 14 local branches, so not quite as many branches as those serving provinces like Ontario, but 14 local branches providing care to over 100 communities. And a number of our branches are involved in this service delivery as well. And the three pillars of our work, much like many other CMHAs, we educate and train with a real aim to raise awareness and reduce stigma and discrimination. Last year alone, we reached about 1.2 million people indirectly and directly through training and awareness activity, and close to 200,000 through direct service, both with our partners and through services we offer. And Kim leads, alongside a small but mighty team, our systems transformation policy and advocacy work. So we're always fighting for change. And one of our key priorities for change is how crisis care is delivered in BC, with the aim for the right kind of care at the right time and to really, really move towards decarceral, non-coercive practices that are trauma-informed for folks who are experiencing some of the most vulnerable moments when it comes to crisis and mental health. Kim, over to you.
Thank you, Johnny. So we're going to start this kind of the content here just with a bit of a question for the audience. And so we're using Slido. So if you can use your phone and use this nice QR code to get right into the question that we're wanting to ask who is currently the primary responder to crisis, particularly mental health crisis in your community. And so I'll give you a second here to capture this QR code or join at slido.com. There's a number here, 3427799, for you to answer. We're just trying to get a sense of what people are bringing into the room. And while you do that, I'm just going to exit my screen here so that I can show the response. A few more responses coming in, but unsurprisingly, quite a significant majority of folks, communities that folks are from, are experiencing police and law enforcement still as sort of the primary responder to mental health crisis in community. And that has very much been the default in many communities, given large-scale divestment from mental health services over the last few decades. And sort of a increase in complexity and challenge in community. And so it's really helpful to know. I will hop back into my slides here. So I think that the Slido here kind of just demonstrated that there are generally kind of these sorts of pathways into crisis care and the sort of status quo right now. And, here we can see how CIRCLE, our crisis response community-led work, really relates to the convention theme around justice beginning early and looking at innovative intervention to intervene early. And what CIRCLE really is a response to gaps within our crisis system. So similar to the experiences of you folks in this room, police in BC have become the default response to mental health and substance use crises. And often they're, tasked with delivering services outside the scope of their core duties and training as a result. And we know that this can result in unnecessary interaction with the criminal justice system. It results in the overuse of burdened and challenged emergency departments. And it's overall inefficient, costly, and can sometimes be fatal for people experiencing crisis, right? And so what we're trying to do in BC is really start to think about things differently. And so we have a vision for crisis care that really, folks have probably heard this before, delivers the right response at the right time. And this model here is really built out on some work that's happened in the US and elsewhere with sort of three pillars of crisis care: someone to call, someone to respond, and somewhere to go. And CIRCLE was really developed with the understanding that an underinvestment in an evidence-based, community-based care increases demand for the most expensive types of mental health and substance use treatment and support. Like I said, emergency departments, hospitalizations, and police involvement. So we really need to build a stronger system of voluntary services. And what CIRCLE really aims to do is to build out that middle pillar around ensuring that somebody is there to respond in person. To mental health and substance use crises in a person-centered, compassionate, and voluntary way. And so ultimately, that's what CIRCLE is. It's a community-based, community-led mobile crisis response team that provides mobile services to folks experiencing crisis who are aged 13 years and older. It's consent-based. So really centering understanding and compassion, trauma-informed and person-centered care is key to these teams being able to really successfully respond to and support people in their time of need. CIRCLE dispatchers are assess incoming calls through community to a local number. We're not integrated into 911 yet, and we'll talk more about that in a second. And, should the call meet the scope of CIRCLE services, a team will be dispatched of at least 2 crisis responders. And in BC, CIRCLE operates under a single model and a single training program. And our goal is to really provide a predictable level of care that strengthens our crisis response system and supports cross-sector collaboration. And I know Nick is going to talk a little bit more about sort of the model and the training in a little bit, particularly who these crisis responders are and what they bring to the table. But as I set out a bit more context, I'll share with you that we have 6 CIRCLE teams across the province. And so at BC Division, we sort of are the backbone administrator and supporter for these services. We're not delivering services themselves in community. They're being delivered by community-based organizations, deeply embedded with strong relationships in their community. And Circle began as a single pilot. So in North and West Vancouver, at our CMHA North and West Vancouver branch, we were able to work with them to pull together a patchwork of grants to start up a pilot. And so there's a really key learning here about just trying something. It wasn't long-term sustainable funding. We didn't quite know where it was going to go. But what ended up happening was that we kind of built this idea around needing to respond to community need, knowing that there needed to be a different option than police for people when they are experiencing crisis. And building that pilot on the North Shore, while quite small and not really seeing any sustainable funding, started to raise some excitement in the province elsewhere. And in particular, the local governments of the City of Victoria and the City of New Westminster reached out to us and the province and were really keen to see something similar in their communities. And we were really grateful to the province of BC, who provided funding to maintain the pilot in North and West Vancouver, as well as pilot Circle in Victoria and New Westminster. And the remaining communities that you see here, Prince George, Comox Valley, and Kamloops, also expressed an interest in Circle through a public engagement process. And we worked with the province to assess community need and readiness. And the province selected these next 3 communities to expand the pilot. And so we're really lucky that, we've kind of firmly moved out of pilot mode. We are now baseline funded for these 6 teams in the Ministry of Health's budget provincially. The investment in Circle really has been under the banner of the Safer Communities Action Plan, which has been a core pillar of Premier Eby's work here in British Columbia, with the real goal of shifting mental health crisis response to a mental health response and allowing police to really focus on the core duties of their work addressing crime and public safety. So we have a public commitment from the province to fund 10 Circle teams across BC. We've currently got funding for 6, and we continue to advocate to see more Circle teams across the province. What I will say about these teams too, so as I mentioned, they are operated by local community organizations. And so on the North Shore, we've got our local branch. Victoria and Comox Valley are operated by AVI Health and Community Services. And the Comox Valley team in particular is operated in partnership with Comox First Nation. And Prince George and Kamloops as well are operated by local Aboriginal Friendship Societies. So we've really started to build in Indigenous leadership into these teams. And then finally, New West is operated by Lower Mainland Purpose Society. So really, really strong community partnerships have been really important in getting these teams off the ground and really working to serve people in their community. I mentioned that our role is sort of like oversight, backbone support. And what that really looks like is a lot of different things. So the funding from the province flows through CMHA BC, and we do a lot of different things to really support the teams to create quality and consistency, but also allow teams to really build the local flavor of their teams in responding to community needs. So we've set out program standards and minimum operating requirements. Safety and quality assurance processes. We develop all the training and deliver all the training. It's over 100 hours of training for crisis responders before they hit the ground to respond in community. We support communications and branding. We've got a great community of practice that brings together crisis responders across the network. We also do all of the evaluation and data collection, monitoring. We're working with an external evaluator, actually out of the University of Toronto, Dr. Nadine Reed. We work with the funder, really. So what we try to do is actually take all that stuff that organizations who are providing frontline services, maybe, it just adds extra work to their workload to allow them to really focus on serving community. And so we take the advocacy, we take the funder relations, and we really try to kind of create a protective bubble around these teams so they can live out their values and really focus on serving folks in need. So I will pass it over to Nick to tell you a little bit more about the model, who circle responders are, and really bring that sort of flavor of lived experience leadership and yeah, what makes Circle special, really. So over to you, Nick.
Thanks so much, Kim. And so folks might be curious, like, what does a crisis response team look like? So these teams are made of, depending on the shifts, they have managers, shift coordinators, dispatchers, crisis responders. Some of those are full-time or part-time in lines, and then casual workers to make sure that we can continue coverage throughout when those services are open. So we do have two pathways into being a crisis responder and taking on that role. This is quite similar for the dispatch workers as well. But these are made up of peer support workers, social workers, clinical counselors, nurses, other folks that bring in skills around crisis care and mental health support in our community. And it is actually quite interesting to see the different walks of life that people come from and what they brought to this program. And it's also such a strength of the program because people such as paramedics or psych nurses bring a particular lens that helps inform a more holistic view of how we can provide care and good care in the community. Each of these workers receive the same training. So when we talk about lived experience leading the way, whether someone is a mental health professional or coming in through more the peer lived experience lens of the work, those two people serve the community and step into crisis care calls as equals. They receive the same training. Each of our workers currently receives over 100 hours of training. A lot of that is facilitated by CMHA BC and growing. We're just about to release another phase of training for our teams based on feedback from what they need to make sure they have all the opportunities and skills to do their job. So they utilize this specialized training to reduce distress, provide safety and support until the crisis is resolved, a crisis care plan is developed, or a referral to another service is accomplished. So what we really work with our workers to determine is, of course, people in crisis are going to have maybe ongoing needs for support, but where we can really show up is for that acute crisis, that acute emotional distress, help people regulate their nervous systems, help people explore either what resources do they have internally or already have that they've engaged with, or what services or referring partners can we direct them towards so that they have all the information and choices they need to take care of themselves. And I think we're very proud of the way we work with referrals within the system as well, because it's often if someone needs, say, for instance, housing as a support, I mean, we'll go to the shelter with them, maybe do the tour, and then maybe step back in the vehicle and say, how did that land for you? Is this the right resource? So it's not just handing people pamphlets, it's actually making sure people are actually attached to the services they need, and that's something that's a big part of our experience. On the next slide, I just want to talk a little bit about how lived experience really drives the way in terms of program design, advocacy, consent-based service delivery, and all of those pieces. So I actually want to share a little bit, and it's funny because it's being called Circle, and we usually use the pun and intended. We go full circle, but I think my first foray into crisis care was myself accessing crisis line when I was 17 years old. So I was going through my own mental health distress. I recently lost my mom. I wasn't sure what to do. And it was actually my partner at the time. Her mom said, well, have you ever called a crisis line? And, I didn't really know what that meant. I'm like, okay, there's kids help phone. That's a thing that exists. I didn't really know how to engage. I didn't know what was needed there. And so she's like, well, let's look up the number. You can use this room here, take your time, make this call, right? And I'll never forget that feeling of just being like so nervous as that phone was ringing, but then immediately just being held with so much care, so much positive regard. I think the first thing they said is like, thank you for your bravery to make this call. You've made the right choice. And my anxiety there just went down and I did land in the right place. And I think maybe even some respects that conversation, maybe even saved my life at that point in my life journey. So I'm so grateful for that. But why it's important for our conversation today is I think every decision, we make as a team, everything that comes across my desk that I'm reviewing, I really try to think back to that time and think about that teenage boy and what he needed at the time to be cared for and to be held with respect and the right type of care and my own autonomy of choice and consent of how I engaged with that service. And so now, fast forward to where I am now in my life, being, part of a team working with these community service providers across the community to build this service is, I think that's always central in our conversations is what does this mean for the community? And sometimes that's very broad and it's something we can build in terms of structures to serve everyone using the program. And sometimes it's very specific, even in our commitment to decolonization for one of the teams, and elder is one of the key wellness supports for that team because of the demographics of the people on the team, the people accessing the service. So we want to make, like Kim said, we want them to focus on the care. We build the structures, but when the structures need to do something a little bit different to really live that value of lived experience, then we position our resources in that way to make sure people are getting what they truly need. And I think maybe hop onto the next slide.
Nick, do you want to say anything here just about the last piece in the slide around equal training
Oh,
or roles
absolutely.
and
Yeah.
pay?
Yeah, thank you for flagging that, Kim. So we're really pleased to announce because I mentioned earlier that all crisis responders, whether they're mental health professionals or lived experience workers, it's the same role. So they receive the same training, even though they come from different pathways rather. But what is really, I think, something we're proud of in this program is all of those workers receive the same pay for the same work. So there is pay equity across the board for all crisis responders. And also, this is actually driven by a lot of the mental health professionals as well. So everyone, I think, was really on board with we're all doing the same job. Maybe we bring that experience from accessing recovery, housing, crisis lines, or we learned it in a classroom when we did our social work degree, but all of it matters. And I think that value is held with such high regard across everyone on our teams, and just really excited to be part of a community that honors that, not just in the statements and the things we say, but in the work we do each and every day. So building in resiliency, and when I think about this part, I always think about when I built programs in the past, and most definitely in this program, is what's really essential is that we show the same care for the people operating the service that we do for the people receiving the service. So what really centers all of that is care. So a lot of what we've built into this provincial infrastructure, because we know mental health workers are sometimes overwhelmed with, burnout, inability to access other services, feeling like they have to extend beyond their roles to get people the thing we need. I think that's very common in the social services experience. And we know that leads to like burnout, compassion, fatigue, other things. So something that was really important to us on the outset of this program is how do we make sure we're taking care of our workers and living the same principles that we want to provide for the community service itself. So all the workers and all the teams receive clinical wellness supports. They have great benefits packages. They do team building and I think support activities. They all receive individual clinical consultation and group consultation on a monthly basis. So they have those check-ins. We also have a community of practice. So once a month, there's 2 opportunities for all the workers across the province to come together. And sometimes that looks like we'll have a guest speaker, maybe an elder from a specific nation talking about, how we can reflect on how we show up as good advocates for decolonization. Sometimes it's just troubleshooting specific things on a call and doing case consultation and how we might deal with different things like maybe someone who's experiencing psychosis or someone that's really stuck in terms of access to housing. So any of the challenges that come our way with the program, we really bring that back to the space to brainstorm together. How do we make sure everyone gets what they need? We also provide that data-driven learning. So we know that data and talking about the impact of things is such an important vehicle. We know that sometimes frontline services really have limited time to engage in those things in an effective way. So that's something we've taken on is to find an easy way for them to tell the story of all the work that they're doing in the community and using that to advocate for how can we build more of these services across the provinces. This across the province. This includes also, in our work, just operational resources. So something that we're working on right now is our practice framework and our worker handbook. So really a lot of that back end support. Again, we encourage all the service providers to bring their own flavor and needs to it. But at the end of the day, we want not only that safety net, but all the groundwork done so that rather than having to build things from scratch, either for their team or each time we add a new team, a lot of that legwork is already done, and then they tell us, how they can make that serve the needs of their community specific for them, or how can we improve our systems province-wide based on their lens of things to make sure everyone has access to ways we can improve those resources. We do so much work with training and development. We have a full-time training manager and facilitator that spend most of their time on the ground with teams, making sure they have all the skills they need to show up confidently in the work. And so I think all those pieces really are inform like our commitment to care. It's not just about making sure, again, the people in the community accessing the service are cared for, but when someone leaves a shift at the end of the day, they know they have everything in place that they need to go home, feel good about the way they showed up in the work, but also be able to let go and know that the other people in their team and their community are holding space while they rest and relax before they step into their next shift. I also want to talk just a little bit about the community and systems impact. So since the first team started delivering services in January 2023, we've responded to over 12,000 crisis calls across the province. So we're really happy to see that there's that great engagement, whether that be people that are having a situational and singular crisis or people that are living in chronic crisis that need ongoing support. Either we're able to provide that support or provide them with the right pathway to support. So we're just really excited to see that level of engagement as it's still fairly early days in this program in some respects. The other thing that's really important to us is 98% of the time, these calls were successfully resolved in community without the need for emergency services intervention. So something we talk about is the right response at the right time. Kim talked earlier about like policing resources, emergency resources. Well, 98% of the time people are calling us, we are the right resource, or in some cases we can refer that out to like a crisis line or a lower level resource that is appropriate for the person's need at that time. Most of the time when we are actually escalating a call to emergency services, which is less than 2% of the time, that's generally for a medical emergency. So it's beyond the scope of what the services that we can provide. But just really happy to know that we are that service that the community trusts to call. The community also knows when it's appropriate to call us, and we're also trusted by emergency services to take on calls that they know this is more appropriate for a circle team. And we can focus on what our role is, whether that's dealing with community safety or other parts of their portfolio. We also have over 125 crisis workers across the province that are part of our program, and that number is growing each and every day as the teams continue to scale up and offer more services in our community. And just to showcase some of the, I think, important stories of impact from our community to show really, I mean, I think we're engaged with folks at all levels, whether it be the political level, the systems level, the community level, is how is this working for you, and are you getting what you need to make this service something that we continue to build across our province? So just from a Circle service user directly, Circle was so supportive and helpful when I was in crisis. They gave me a safe space to cry and express my true feelings. I don't think I'd still be alive today if it weren't for them. And I think that's probably a story that a lot of people would tell. And I think that space and that time to process and do what you need in those times of crisis is something that's really unique to our service. Emergency responders are generally in a call queue. They have lots of things to attend to. But where our service is at in the meantime is we can really sit with people and take all that time that they need to start telling their story or to think about what they need in terms of safety or supports. We don't need to rush through a risk assessment. We can just sit with them and be in validation and take our time in that regard. And just a couple other pieces to share out. One from the former Chief Constable Dave Jensen at the New West Police Department. I think all the police departments across the province that host a Circle team have been very supportive and great partners to work alongside of, setting up our services, finding our role in the community. So that's been really great. And just with the other story of impact as well from a paramedic who accessed the service. Just I think for finding out, how we support emergency services, find that right match for our level of service. And it is funny because we do employ a number of paramedics across our teams. I think the first thing they say to me when they meet me is like, wow, I wish I had this service when I was a paramedic because it is so needed. Because often people are in crisis and emotional distress. We're sitting there with our oxygen masks, not sure what to do. And if someone like Circle could come be on the scene and really attend to those person's emotional wellness needs, I mean, mean, that would have made all the difference. And that's actually what's compelled some of those folks to come along, is they see the gaps in emergency services and realizing that actually this is something Circle can fill really well for these folks in the community. So yeah, happy to share a little bit about the service on the ground today with all of you folks, and excited to continue to build this service in British Columbia. So I think with that, back to you, Kim.
Thanks, Nick. So the last little part of our session here before we take questions from you folks, I've seen some come in already. We really, again, want to come back to you to understand what are some of the barriers to effective crisis response in your community. And I'll spend the last slide after this kind of talking about the enablers that we've been able to reflect on and being able to do this work in British Columbia. But it would really be really great to hear from folks in the room. What are some barriers that you see to effective crisis response? And I've listed some examples here, but there could be other examples, and this is sort of an open answer question. So same as before, using the Slido, whether the QR code or directly to slido.com. Please throw in some of the barriers that you've experienced. We'd be really curious to hear, and then hopefully be able to respond to some of those barriers and the enablers that we've been able to reflect on for Circle. So similar to last time, I'm going to exit out of here, and oh, you're getting a little sneak peek there. We'll go to the next question here. So what are the biggest barriers to effective crisis response in your community? I see one participant typing. That's good. That means it works. 4 participants. Great. Lack of resources. Yeah, that's a big one. And I recognize that in BC, we are so privileged to have a provincial government that is providing provincial resources to be able to scale this at sort of a provincial level. Small community, everyone knows everyone's business, scared of being judged. So that stigma piece, yeah. Lack of proactive supports and lack of harm reduction approaches, yeah. Lack of coordination, conflicting mandates, yeah. And I think that's, continues to be a challenge for us too. When does our service start and another one end? Lack of resources, stigma, training, limited crisis supports, yeah. Different municipalities being responsible for different services. And that's where kind of having provincial level funding for us has been quite helpful, because it has allowed us to kind of take a provincial approach, but really having to work in partnership and alongside municipalities to also ensure that their needs are being met too. And municipalities really in BC were such huge advocates and partners in advocacy for us to see these services in community. Lack of resources. Yeah, limited hours of service. Yeah, collaboration. So seeing lots of themes here around lack of resources, challenges in collaboration, stigma, lack of knowledge among the public about where to call. Okay, I see one more participant typing. I'll let the last person add there. Okay, re-traumatizing and fear of police. Yeah, 100%. And I mentioned earlier that we're not currently integrated into the 911 system. I'll talk about kind of the process for how what we learned about how we came to be in a moment here. But we are really starting to think sort of long term with Circle. How do we make sure that no door is the wrong door, with 911 integration being a goal of ours, so that somebody who calls 911 has the potential option for Circle in the community that they live in, if Circle is available there. But also, how do we ensure that there are other pathways for folks who don't feel comfortable calling 911? And I think we've seen and heard anecdotally that there are folks who have called Circle in their time of crisis who would have I'm not sure what they would have done alternatively because they wouldn't have ever felt safe calling 911. And so there's quite a need there that we've been able to uncover through the work. So let me kind of pick up this last piece here around enablers. Um, so the first enabler is really around leveraging policy windows for systems change. And when I use the term policy window, what I really mean is the sort of social, political, economic, all of those big contexts kind of coming together to create a sweet spot of an openness for systems change. And when the Northwest Vancouver pilot started, it was really in the context of the aftermath of the killing of George Floyd in the US and the push from Black Lives Matter. But we know for decades, people with lived experience, people from equity deserving communities have really pushed for alternative ways of caring for people experiencing crisis. And we really were able to kind of capitalize on that policy window at the time, which luckily we were met with a very open and supportive provincial government and also local governments. But really identifying when there is that policy window and being able to act, it was a huge enabler for success. I mentioned how we just started the pilot with kind of a smattering of funding sources and, no kind of infrastructure developed. We kind of really built it as we've built the plane as we've flown it, so to speak. And so I think leading with action to demonstrate impact is a really strong enabler in this case. We kind of did first and asked for sustainable funding later. And I know that's a risk sometimes, but in this kind of age of austerity with governments, tightening the purse strings, where and when we can, being able to demonstrate impact and go to government and say, see, we've done it, is much more impactful for government to say, okay, actually, we'll fund you. Innovating beyond traditional systems. And so this is what I was talking about earlier around we're not integrated into the 911 and the emergency response system right now. We've kind of built outside of these traditional systems and institutions, which has really allowed us to build a strong foundation based on our values and the things that we want to see in the service, really led by the voices of people with lived experience and the communities that are being served. And I think there are pros and cons to either way. What it's meant is we've had to kind of build relationships over time to be able to ensure that we are more adequately integrated into those sort of traditional systems and institutions, which takes longer than doing it from the get-go. But it's also allowed us to build and protect something very special in Circle. And so I think that there's something to learn from that process here in British Columbia in particular, just how we were able to kind of build something and then slowly ensure that we're kind of starting to interface and integrate with traditional systems, but not be subsumed by them, just to maintain our values. I know Nick talked about this a lot, centering lived and living experience as core expertise. This really is, I like to say, the secret sauce of Circle success. Time and time again, folks who receive our services are really say it's the lived experience piece that really allowed me to connect. And so any crisis response that is able to center the needs of people with lived experience and center their leadership is going to do well in community. The next one is around redefining funding relationships through partner, and we're kind of bucking the traditional funder-fundee dynamics here in BC through relationship. And so we're not at BC Division just saying, okay, here's your money. We'll see you in 3 months' time for your quarterly report. It's really, as Nick mentioned, quite relational and symbiotic. We work really closely with the teams. When something bubbles up, we're there to support them. There's no like, oh, I don't know, we shouldn't tell them that because they're our funder. We're really on the same page, really looking to see the same outcomes. And I think it's an interesting case study in BC around how we can kind of learn at a systems level about how that sort of funder-fundee dynamic and relational piece can actually be implemented in other sort of funding relationships to have better outcomes for people in community. Hopefully you've heard that there is strength in having a provincial network. Again, we're so lucky that we've been able to scale this at a provincial level. But as you can imagine, we're strong because we have 6 communities across BC, and there's ripple effects, right? Those local governments, those police forces, the community partners, the people on the team, and then everybody at BC Division, we're all strong advocates for this service. And being able to leverage the strength of that provincial network and our advocacy has been really important for our success here in BC. And related to that, really cultivating allies and champions across the system. And you saw some quotes, for example, from the former Chief of Police, Dave Jansen in New Westminster, finding those allies and champions to really speak to funders, in particular, in this case, the provincial government, to say, this is why it's important, this is why we need this type of service in our community. Has really allowed us again to be able to scale and expand the way that we have because we've got those folks in our corner. The last piece I'll say, and we'll round it out for questions, is really around embracing productive tension and adaptive learning. And I think everybody on our team, Johnny, Nick, myself, and everybody else, has really gotten used to kind of working in tensions and working in uncertainty, I think, allowing things to emerge as they do. And it's hard sometimes. We're constantly working in tensions between growing this network and growing the service in BC with needing to kind of stabilize and develop some of those core infrastructure pieces, like Nick mentioned, like the practice framework. We haven't been able and haven't had the luxury, and in some ways it's a benefit, but to actually build some of the foundational pieces and then go and launch in community. We're really building as we go. And so again, an enabler for us in BC has really been being able to work in those tensions and sitting in that discomfort of not always knowing where we're going to go. But I think what it's been able to do, and Nick talked about like being data driven, is we've really been able to create a bit of a feedback loop. So we'll go test something in community, we'll test something in conjunction with the service providers. They'll come back and say like, oh, I don't know, we need to tweak it here. And it'll kind of feedback loop itself into improvements over time. And so that adaptability has been such a key enabler for seeing this service grow and thrive in BC. So I'm hoping that some of those enablers might get you to start to think about ways in which this might be possible in your community or your province. I know there's lots of folks from Ontario here and maybe elsewhere. And I know we've printed out or we've got a handout that should be available on the platform for you to kind of think through these enablers a little bit more with a bit more information about how we've been able to apply them. Because we're really hoping that you might walk away today feeling inspired about some of the things we've been able to accomplish here in BC. So I think this is our information here, circle.ca. Feel free to follow up with questions. If you don't get them answered today, circle@cmha.bc.ca. But I think with that, I'll end my slideshow and pass it over to Julie to facilitate the Q&A.
Great. Thank you so much, Kim and Johnny and Nick, for your presentation. I really like the enablers at the end. I also volunteer for Crisis Helpline, so it's nice to see other forms of crisis line, and I like the way that you want to integrate with 911. I think that's a really great idea. So we'll move forward with the Q&A now. We have 2 questions so far, so folks feel free to add more if you have any questions for our presenters. So we have one from Aisha. Hi, on your website in the FAQ, you've written that Circle is one of over 220 worldwide community crisis response without police. Where can we find that list of over 220? My research team is actually conducting a scoping review on local and global non-carceral community crisis response, and this list would be beneficial. Thank you.
I can hop in on that one and maybe also share a link. That number, it might have changed, but was received from work by Jamie Livingston, Dr. Jamie Livingston on the East Coast. He's got a website, I think it's called Just Mental Health, but I'll post a link in the chat. And he's actually been able to map a lot of these very similar civilian, non-police led crisis response teams across North America and actually the world. So I'll find that link and post it in the chat. Sounds like it will help with your scoping review.
Great. Thanks, Kim. We have another question from Tor. So CMHA Ontario has been expanding their police-partnered crisis response programs, often called IMPACT, Integrated Mobile Police and Crisis Team, across the province. Did CMHA BC consider such a model before determining to proceed with the Circle, ION police model? Do these models exist alongside Circle in some regions of BC?
Do you want me to start this one, Kim, and then hand it to you?
Sounds
Yeah,
great, Johnny. Yeah.
yeah, it's a great question, Tor. Thank you so very much. Um, I would say in British Columbia, there's been fairly significant historic investment in co-response models, and so that there are different variations on that theme. And some of those co-response models, so it might be a nurse ride along with a police officer, or a more deeply integrated police officer health team. They've been on operation for quite some time, and so they've served a very real purpose in British Columbia as part of the continuum, and we recognizing that had already got some history. Our departure point, our starting point was to have a fully civilian team with no police involvement. And what we've seen in some communities, Victoria is one of them, is Circle. So our civilian team actually is sitting alongside other teams as part of a broader continuum in some neat ways. Victoria is one of the more fully resourced teams. So there's our team. There has been kind of a co-response insert team for a while. And the province, BC, as a funder, has stated that they're supportive of both models, and so they've invested in both models and sometimes in coexisting communities. And I think over time and through our evaluation work, we're working with Dr. Nadine Reed, who's been a fantastic evaluator specialist with us. I think we'll start to see the impacts and the benefits, and perhaps some of the issues we have to manage around having Circle in a broader continuum of care. So that was our very, very deliberate starting point and decision point in BC, um, in a way to provide as much diversionary power as possible, recognizing there'll be particular call types that are better suited for co-response, and through and through. Kim, I'm not sure if you'd add anything to my answer there.
Yeah, thanks for that, Johnny. And I think just coming back to that really impactful statistic that Nick shared, around 98% of our calls being resolved in community without the need to escalate to emergency services. I think um, where the teams are really starting to build some strong relationships and get clear with local police around when they do escalate, and where, like I said, when our service ends and theirs begins is really important. And in the communities, and there are a few where there are co-response teams, very similar to the teams described in the question here. Um, being able to ensure that the co-response team knows, like, this is the threshold for when a circle team will engage emergency services. And the goal, I think, is instead of a purely police response, if police are required because there's an imminent risk to life or limb or safety, being able to call in the co-response team that will continue to have that sort of mental health and psychiatric experience and expertise on the team is the real goal, right? And so I think we all exist along a continuum. There are many calls, and in our case, 98% of our calls that don't require police involvement at all, and then there are calls that do, right? And so I think there's space for all of us in the continuum there, and what we've heard from community and from people with lived experiences, they want and need alternatives to policing, and I think we've been able to provide that. So I don't know, Nick, if you want to add anything. I see there's a question here that's clinical in nature, so maybe we can jump to that one, but just want to make sure you don't have anything to add on the co-response question.
No, nothing to add on that. Thanks, Kim.
Great. We have a raised hand from Aisha. Would you like to ask a follow-up question?
Hi, yes, thank you so much. This was a fantastic presentation. I do have another question, or it's not necessarily a question so much as I guess it's a comment. So I know you guys spoke to, you're hoping to integrate with 911, which is definitely like, I understand that as part of this project, like it needs to be kind of mapped because like the way that people usually that's the only number that they know, even though there are other resources. My, I guess, comment slash question, or maybe something to think about is that like 911 dispatchers or the people answering in my experience, people answering those phones are very different than the ones who are answering the mental health services. So in Toronto, like the 211 number. And as from personal experience, like they are not as maybe like they don't demonstrate that much empathy, or they for them to be in their job, they're very is the word clinical, like they're to the point. They need to know exactly where your address is, this, and I understand that nature, but at the same time it can really spook someone. So I guess how would you I know you guys have like over 100 hours of training, but it's going to be interesting, I guess, to integrate that, like how that will be, how that will move along. But I would hate for people to be turned away if they're at that front end or receiving they're getting spooked or something, because it's happened to me in the past. And that's one of the things that I've come across working with the scoping review we're actually working on. My team is with the Gerstein Crisis Center, and they are integrated with 911 with the Toronto Community Crisis Service, which also works with the police, but that's different from what Gerstein's community crisis is, which is similar to yours. So these are just things that have come up in that discussion. So I just wanted to ask what your thoughts about, because I obviously see the advantages in integrating with 911, but I also have these concerns when it comes to people at that front, on the front lines, or the front end of it. Sorry, that was really long.
Julie and Kim may chime in with us. I know we're at time. Aisha, just wanting to signal deep appreciation for your question. Kim and I and a few of my board members were visiting Gerstein recently. I've visited twice, and just deep respect and care for the work. And I think you describe a really important contrast. And it's not to say either is better or worse or bad or wrong. It's just that there are different and contrasting operational cultures and practices and criteria and liabilities and perceptions that hopefully we can get mitigated through broader cross-pollination across these roles. I mean, we've recently sat with police leaders in British Columbia who would likely, just in how they came across in their approach, sit in that zone of practicing with empathy first, and not being so risk-centered that everything else kind of fails from view. And of course, there are different perspectives within paramedics and fire as well. So I think there's lots to learn about how approaching triage, assessment, and risk through some of the lenses you described can lead to really good outcomes. And when we're seeing that across our circle teams, and are there cross-training opportunities? And we've definitely benefited from that, like situational assessment, scene assessment, has been long practiced within first responders approaching a dynamic scene where someone's in crisis. So I just want to underscore and validate what an important point you're making. And I think that point will get sharper and more important as we look to integration, because there's lots of opportunity with broader integration of crisis care, and there are likely some challenges too, right? And some opportunities for cross-learning and cross-support. So a great question, observation. Thank you.
Great, thanks. And I saw, Kim, you responded to Jen's question in the chat, so thank you for that. I know we're a bit over time, so thank you to everyone who stayed and to the presenters for this wonderful session. Just a little closing remark. If you can take a moment to fill in the survey for this session, that would be great. It helps us for our future conferences. And we encourage you to take some time to connect with other participants and visit the poster and exhibitor halls. You can also build your agenda for tomorrow's session because right now we have our day one closing ceremony that will be coming up. So feel free to join that. And thank you once again to our three speakers.